Hey everyone, how's it going? I'll give it a couple seconds for people to trickle in. And while we're waiting, I'll share my screen, give it a little bit more for people to trickle in. And then just for context, today we're really going to be going over Heidi following OMA. So essentially we met a lot of you folks at OMA this past weekend. So really get to follow up and show off how Heidi actually works in practice with one of our providers. Just for a warm round of intros, I'm Arthur. I run our growth. I probably have met the majority of you guys speaking, if not the rest of the team. And I'm also joined here by Joe, who I'll let him introduce himself.
Hi, everyone. I might have met some of you at the conference as well. I was there with the team. My name is Joe Zucchi. I'm a physician assistant. I'm the clinical supervisor of Transition Medical Weight Loss in Salem, New Hampshire. And we have an obesity medicine practice here. So I've been using Heidi for a few years as a great tool to improve my workflow, improve my kind of communication with patients, being able to directly talk to them, and then let Heidi take care of all of the note taking and saves time and saves burnout and also improves kind of efficiency. So looking forward to showcasing how I use it in my practice, and hopefully it'll be beneficial for many of you as well.
Amazing, amazing. So the majority of this webinar will basically be Joe walking through how he uses Heidi, but upfront, just spending a quick 5-10 minutes goals for today, and I'll walk you guys through what Heidi is overall. Then I'll pass the floor over to Joe. But the main 5 goals are basically the top 2: getting situated with Heidi. What is it? How does it work? And then how do the templates work to actually create these customized notes? And then the bottom 3, where Joe will cover, would basically be, what is the application in practice? How do we talk to patients? How do we customize it out to my preferences? And then lastly, what is the full workflow from before the session, during the session, even post-session? What does that look like? Can I create downstream documents? Can I help out with any education letters? So we'll go through all these points today. And as we get set up, I'll share my screen here and spend just a very brief couple minutes going through the basics.
Good question from Ben. How do we get this implemented ASAP?
As soon as possible. We'll touch on that very, very shortly. But as I share my screen here, this is Heidi. Again, Heidi is an AI-based transcription tool where you're going to have a conversation with a patient, and instead of needing to either type the notes in yourself manually over the computer or have an assistant kind of edit the notes afterwards, or maybe even if you're using Dragon to dictate, we'll take in that conversation and then create a clinical note that's tailored to you. The way that we do it, so just walking through the platform, left-hand side are some settings that you can preference and tailor out to yourself. And again, Heidi is all template-based in the sense that that conversation will then flow into a clinical note that's tailored to you. Just to walk you guys through what the template looks like, I'll pull up an example note that we may have shown you actually at OMA this past weekend. Ignore the left-hand side for the time being and just focus here on the right-hand side. And we really only use 3 things. 1, we use plain text for the headings. 2, we use brackets for the content or placeholders in the note. And then lastly, we're using parentheses for instructions on how to actually write this. So what this looks like in practice on the left-hand side is, for example, sleep as the header is written in plain text. And then following it, written in very basic English, we have information on patient sleep history and patterns. And this is written in brackets. So in the transcript, any info on the patient's sleep history will then flow into the note, flow into these sections based off of what was discussed. And then lastly, we're using parentheses for instructions. So we're saying, only include the sleep info if it's mentioned in the transcript. So very basic syntax for how to customize, how the note works, and how Heidi works. And then to get started, you'd click this black new session button, you click start transcribing, and you just have your conversation with Heidi. So with that being said, the very bare bones basics of Heidi, I'll pass it over to Joe to kind of walk through how he actually uses in practice, what he does with his patients, what his templates look like, and then also anything that happens pre-charting, during the visit, and also post.
Perfect. So I will share my screen and showcase kind of how I use it on my own software here. So Heidi's available in several different formats. There's a Windows application, there's a phone application, there's also a Chrome extension or just the website. So however you want to kind of lay it out, you've got the options there. And so Arthur, can you see my screen okay?
Yep, yep.
Perfect.
You need to zoom in a little bit. I imagine you have a big monitor over there.
Yes, I do. Yeah. Is there a better way to zoom here?
Are you able to zoom on the app itself? But if not, no worries.
Yeah, I don't know if there's any way to do it directly, but I'll explain as I go. So basically, whether you're doing it through this interface or through the Chrome extension, it's all similar. Like Arthur said on the side there, you have your templates, and I have my own list of templates that I use here, but there's also a community that has all different templates that you can use or share from other people. And so there's pages and pages of templates, so you can make your own. You can get Heidi to help you make one, or you can grab one that's already available. And they're broken down even by specialty. And there's a ton of specialties in here. So Heidi really can kind of personalize your note according to your type. So personally, for my plan, I'm in obesity medicine. So obesity medicine is actually my specialty. And so when I'm working on a session, you can see all these different sessions are listed here. And so I'll just pull up an example of a patient that I had. And you can name the patient if you wish, and it'll keep track of the previous visits, or you can just have it be automatically titled to kind of what the discussion was about. But if we just kind of scale back for a second and think about how this works, the beauty of this is that you're able to just push start transcribing and push your computer away or put the phone in your pocket and just look at your patient. And at the end of the day, that's the goal, right? Is connection with our patients. We want to hear them. We want to be there to support them. We want to be able to focus on the conversation and not be there to kind of have to keep a part of our mind thinking about the notes that we're going to be writing, or not have to worry about transcribing little details on the side. Those are, time-consuming problems. So if you can just focus with your patient, that's a huge benefit right there. And so while it's transcribing, you're just talking. You're not dictating like with Dragon where you're saying, patient reports nausea and vomiting. No. You just talk to the patient and they talk back. It is all HIPAA compliant. It's recording the transcription that's happening, and it's saving that, and it's going to populate the note after you're done. And so the nice thing is you're able to just connect with your patient, have that discussion, don't have to worry about keeping notes. And then when you hit done, your note will be finished within a few seconds. My note is a custom template that I've made that's very simple and brief. It breaks it down nice and easy, and it puts it into just bullet points. For me, that just works well for our EMR here. But you can do it as complex as you'd like. You can see we have the options here from brief to Goldilocks to detailed to super detailed. If you like your notes to be very complex and grab even patient quotes, you can do that. If you want it to be simple like mine and have 10 bullet points, you can do that too. And so you can see there's a lot of options here. You can customize level of detail. You can customize if you want to use bullet points, patient quotes, abbreviations. A lot of that's adjustable. And there's even 2 different scribing models that are designed for either more complex scenarios or just kind of standard interactions. And so in my example, it put it exactly as I would write them. It has, it'll use short cuts, abbreviations when necessary. And you can see there's also a text editor built into here too. So if I want to write this here and bold this, then I can do that. And so a lot of features for that. And you can edit your note. You can just keep on typing below that. It's not like that note is set in stone. You can adjust it as you need to. Now, prior to seeing the patients, I often will do a little like pre-charting where I'll just talk and give it some context. Hey, this patient last week, had some struggles. This week, they looks like they've lost 3 pounds, whatever that scenario may be. And you can just speak that, or you can type that. There's a whole box here called context. And any additional context that you want to add, you can type in right here, and that will be taken into account when Heidi generates your note. And so it allows you to kind of do some texting, or you can do some speaking, whatever is easier for you. And then outside of that, the other beauty is there's tons of different templates. So if you like to have your note more structured style, then I made a different note that breaks it into categories for me. You can see it broke this note down into their just overall synopsis of the week, any adverse effects, their compliance, their food timing, hunger, medication, exercise, energy, sleep, hydration, and such. And the nice thing about this is anything during that conversation that person said will be properly inputted into the right section here. And so whether that be in this format, or if you're more of a traditional kind of H&P format, you can have it breaking down that way as well. So a lot of options. Now, where this gets even more exciting is not only is this saving you hopefully a lot of time by typing notes, and accuracy is excellent, and it even can pick up different accents very well as well. But you also have this box at the way bottom here that says ask Heidi to do anything. And that box serves as like a little chat that you can just discuss with the note and discuss with the built-in AI model here that Heidi uses to go back and ask further questions. So if you wanted to actually, since the whole transcription was recorded, if you wanted to go back and say, what was my patient's dog's name? It'll remember that from the note if they mentioned it during the conversation. But Heidi's very good about not putting things in the note that are unnecessary. So if you're talking about, your lawn and the weather, it won't be in the note unless you request it to be in the note. But you have the ability to customize this to really be the style that you want. Still feel like you can, have those normal discussions with people, and it'll save the good stuff and not save the unimportant stuff. But for example, I asked Heidi to do a patient explainer letter, and I just typed in, write a letter that I can send to the patient to summarize our visit. And beautifully written here, it puts it together. It was a pleasure seeing you today. As we discussed, we talked about your progress, your success so far. Keep up your good nutrition habits. Medication management, we'll continue with this medication dosage. Next steps, things that we have for goals. It even signs it as myself. And so I can literally then just copy and paste this and send it in an email to the person or through my EMR. And the same thing goes for your note. You can copy and paste the note right into your EMR. Heidi does have the ability to integrate directly with some EMRs, so you can chat with Arthur about that. But for me, copy and pasting just works very, very simply. And then even further, again, you can ask this literally anything down the bottom, but another thing I use it commonly for is prior authorization letters. And so I had it say, write a prior authorization letter for Zepbound, and it took into account the patient's BMI, how much weight they've lost. This would be like a renewal prior auth here. But it mentions the patient's been on Zepbound for 5 milligrams or 10 weeks and showing progress. It mentions his adherence to lifestyle modifications and so forth. It requests continuation of the medication. And again, signs and dates it and so forth. So you can just then go in and edit this accordingly and ship it off. And there's also the ability to customize these as well. So lots of different features here. I think at the end of the day, if you want to have a more detailed note, you can do that. I have an example of that here. If you want something more concise, you can do that as well. In this super detailed note, it was still a short visit. This visit was only 12 minutes long, but I asked for the super detailed note. You can see it actually put quotations of exactly what the patient said. And so that can be very handy as well. This person had realized they weren't tracking their food and they were stuck, and then they were very happy after the conversation to start tracking. And then this week they had a very good success after logging, and they realized that what they were kind of not on track with their nutrition. And so if you like that level of note-taking, you can do that too. And so I have all my notes, and it's the notes can be saved for as long or as short as you'd like. You can keep them indefinitely, or you can have Heidi automatically clear them after a day or 2 days or 2 weeks. And so you have full control there with all of these different features. The nice thing about having the backups is if you want to go back to a note from 2 weeks ago and ask it a question, you can pull from that transcript and ask a question. But you always have the ability to just keep on saving those new notes. If you're seeing patients back to back, you could have Heidi just record each note, and then you can copy and paste your notes later or edit them later. And so don't feel like you have to take time between each note to finish it up. You can just keep on going on to the next patient. So very efficient. So I'd say the biggest focuses are certainly one is improved patient communication. You can look at your patient, they can look at you. You're not staring at a phone or a keyboard. You're not transcribing or dictating. Awesome there. Number two would be just efficiency. I honestly save a few hours a day typing notes. I'm not dictating after the visit. I'm literally just looking at the note, making sure it looks good, and then copying and pasting it in. And then that just saves frustration. And then lastly, of course, is these little extra features. Getting the efficiency is great, but being able to go and write prior authorization letters and referral letters and documentation or patient summaries really takes it to the next level. And Heidi's got a lot of stuff in the pipeline for even future stuff. I also may not have mentioned this yet, but it also has the ability to do coding as well. So there's coding features, and you can just sort by ICD-10 code. It'll automatically pick up the codes based on that appointment that may be appropriate. And so you have that available as well, which is going to help with efficiency. And you can have it automatically input ICD-10 codes or even CPT codes if you ask it in your template. So a lot of features. Happy to answer any questions or just explain other versions of how I put it to use. But hopefully this gives you a broad overview of how I use it in my practice.
Thanks. So that was super, super comprehensive. There's actually two questions. One that I'll pass to you, Joe, in a sec, but the primary question of cost. So there's a completely free tier of Heidi where you can just sign up, use it unlimited, and you're just going to be able to use templates tailored to whatever specialty out of the box. And then there's two other paid tiers, which is $7.99 annual per user, which has all the customization you'd want to use. And then lastly, there's a clinic tier, which is $11.99 US annual per user with a couple other features. But happy to chat after about that. And then the other question on workflow was, can you upload patient information like past history and meds the day before and have it there for when you see the actual patient the day of?
Yep, and you can. So Heidi, in that context window right there, you can add anything. You can either type it in, or you now have this little option down here, which is a little paperclip, and you can basically upload any file directly into this that it will take into context. So you could upload someone's lab work, you could upload a previous note, you could upload an email, really anything can be uploaded, and then that'll be automatically formatted in the note. And so I've uploaded a patient's lab work before, and then I wanted to make sure in my note that was listed, and it listed it verbatim right from there. So yeah, it's great to be able to do that. And so yeah, if you want to pre-chart by doing it that way, you can by having the pre-context here, or like I mentioned, when you start speaking, you can just talk and say, hey, I'm looking at the patient's lab work. They had an A1C of 6.4, and that'll be taken into the note as well. So two ways of doing it. And note that when you're speaking, you can also pause and then resume it if you wanted to go grab the patient, come back or resume, or you can just keep it going. Even if Heidi's running for 20 minutes in the background afterwards, it never, no issues. It really is very efficient at picking up what it needs to make the note efficient.
Yeah. And then I see Elizabeth is raising her hand, so I'll do a live call out.
Sounds good.
Hi, Joe and
Elizabeth.
everybody. It was great meeting you guys at OMA. I do have to say that I have been piloting it and it's like amazing. My question is, if you're using an EMR, like let's say we were using Epic, how do you integrate Epic into Heidi? How does that integration work?
Yeah.
What
can take
like
that.
you answer that, Arthur? Yeah.
Yeah, so with the Epic integrations are more so site-wide in the sense that we would need to, for example, with your ortho group, we need to work directly with the ortho group to build out a specific Epic integration between Epic and Heidi. But for the main use case of kind of smaller clinics or individual use, that integration wouldn't be in play. But the nice thing about Epic is because it's a large text box, you could one-click copy the full note from Heidi back into Epic and then make any modifications there. So on Joe's screen on the top right, or I guess the middle right, there's a copy button. It'll copy the formatting and you can just paste that back into Epic.
So if you have like charts and stuff in Epic that you upload, like weight charts, stuff like that, that's in Epic under like, a dot phrase or something like that, how does that integrate into Heidi?
Yeah, so it doesn't directly integrate into Heidi in the sense that we would read that file. However, what you can do is you can either verbalize it into Heidi as a pre-chart like Joe mentioned, or if you have those documents, you can upload into Heidi through the context. Separately, what's been working really well is for the initial consults, folks would use Heidi to kind of create that comprehensive note. And then for any follow-ups, what they do is actually they just pull through the info from the initial consult. And for mainly the subjective, the HPI and the AMP, they'd use Heidi for that and pull through the medications for everything else.
How do you pull in meds from the chart into Heidi?
Yeah, so you can either copy paste it into context, or you can upload those attachments through the attachment upload in context. Or again, you can also verbalize, you can give a 30-second monologue saying, patient Arthur's coming in, he's been using Tylenol over the counter, he's been prescribed XYZ, he's been using this for the past 2 months, and then you're gonna have a follow-up. Alternatively, in Epic, if you're gonna pull through the info on the patient, and the main pain point is just writing the qualitative subjective and the qualitative impression and plan, that's when you can tailor the template to only be just the subjective, just the A&P. And then Heidi is not an EMR. Heidi is solely a transcription tool to help with your note taking for pre-charting the progress note as well as any downstream note.
Got it.
Yep. And then a couple other questions. So does it read handwritten notes? Our attachment upload does help out with some handwritten notes, but obviously if it's chicken scratch, if it's very, very tough cursive, it'll be a tough time. There's also a file cap of 20 megabytes per upload. But for the most part, if you were to upload image or scans or kind of those more complex documentation, it may take a little bit for us to process, but we'll still process the majority. And then for any other questions, feel free to shoot it through the Q&A at the bottom, just for others to kind of see the questions flow in as well. But I guess for Joe, for some of the templates that you're sharing here, it might also be interesting to see how exactly you've written them, you know, how customized you made it, and how you might actually do so.
Yeah, so you can really kind of customize your templates however you'd like to. I kind of have mine just keeping it based on the content that I'm usually looking for. And I told it exactly to how to format it because I just want to keep it simple, straightforward, short sentences, and it follows that instructions pretty well. And then on other notes where I want something a little bit more complex, I'll show the example of this one here. I wanted to break it down to specifically these categories because these are the common questions that I ask on a frequent basis. And in these types of scenarios, the template's a little bit more complicating here, but you can see, similar to how Arthur demonstrated, there's instructions that are kind of in brackets that explain what part of the conversation I want to be put in there. And then there's titles that are also going to just carry their way through. And then there's parentheses that says, like, if we didn't discuss this, then I don't need that section altogether in there at all. And so these are nice because you can basically guide it exactly how you want it to be. And the templates really can, you know, follow your style of talking and typing, whether you like, you know, short sentences or more paragraph style instead. I prefer more of the bullet point style, but it spaces it out beautifully. And yeah, the accuracy has been great. And, you know, I will point out, especially in our field of obesity medicine, there is a lot of text-to-speech tools out there that are just not good at medication names. You know, my phone can't even spell Wegovy right, and it's been around for many years. Heidi has a really good text-to-speech model that is accurate with spellings of medical terminology. It is very good about brand names as well as generic names. And not only like Zepbound, Wegovy, tirzepatide, semaglutide, it actually has retatrutide and orforglipron in its dictionary already. So those are words that I was impressed to see it spelled right already. So yeah, if you're, you know, used to previous tools where you're constantly fixing typos, that is not the case with this. There's very, very little editing I have to do with my notes afterwards. It's basically exactly how I like them. So efficient.
Yep, makes sense. And then also workflow-wise, do you typically just transcribe it, or do you also resume or add in additional info after?
Yeah, so after I'm done, I might pause the note or I might just finish the note. But if I, or if the person left on it, you can just continue talking without even pausing at all. I might just add a little extra context about, you know, things to think about for next week's note or, you know, follow-up questions I want to remember to ask the next time we meet. And so I sometimes will give it just some pre-charting or post-charting little context just to make the note exactly the way I want it to be. And rather than me typing stuff, it's easier just to speak it and give my thoughts. And I've even had the, Heidi's very good about, you know, understanding the context, but it's even able to, I've had sometimes two people in the room and it was able to still distinguish the conversation. And I said, break the note into two sections, one for John, one for Sarah. John will be talking about Zepbound, Sarah's talking about her knee issues, and the topic typically flows nicely enough. So Heidi's very good about being creative enough to break apart things. So give it a try for sure. You'll be amazed at how successful it can be.
Yep. Amazing. And also if you kind of go through the settings on the left-hand side, there's a couple of preferences you can change. So for example, in preferences, you can change the style of, I guess, default. So whether the template that you're going to be using by default is going to be set in stone, or you want to choose something each time you generate. And also, again, like Joe mentioned, kind of the level of detail, the brevity of the note itself. And then in the memory tab, that you can also change some preferences that you may also want to tailor yourself, whether it's the date format, the default input language, whether it's English or if you're in kind of a Spanish predominantly speaking area, or also even the spelling, whether it's US based, Australian, British, UK. I imagine majority will be US based, but in addition, you can also change how you want to refer to the patient or the clinician. So patient, it could be explicitly first name, last name, if it's provided, or it could just be the initials. For the clinician, it could be, doctor full name. It could be doctor full name plus the credentials. It could just be doctor last name. However you want to kind of describe yourself, you can add those preferences. And then, like Joe mentioned, we have coding available as well. The last thing that you can do is we have snippets at the very bottom. Those are going to be your typical macros. So let's say if you have a snippet where it's slash certain phrase, that'll just print out the associated text associated with that snippet as a typical macro would work. But if there's any other questions on the workflow and how you'd actually see this in practice, feel free to shoot those to the Q&A and then you can field those. But the main question I've been seeing is, how do I get this implemented and what's the timing? So actually what you can do is you can sign up on our website for free. That completely free version will have out of the box templates free, so SOAP, H&P, issues, etc. And then depending on the specialty that you set, so whether you're a family med, general PCP, or obesity med specialist, we'll create kind of a boilerplate template specific to that specialty, free to use, unlimited use, no cap. However, if you wanted to then create customization, say, I saw a patient Arthur specifically at the clinic of XYZ in Northern Virginia, use of that is then capped at 10 times a month. And then on the paid version, there's unlimited use, unlimited customization. But following this, we'll be sending over a follow-up email to everyone who joined just to kind of reach out. We do group onboarding sessions. So it'd be good to kind of share this off with you guys, actually walk through implementation steps and hear how others might have questions on their workflows that maybe in the moment may not be apparent, but you realize, oh, this is actually a good point. How do I do this? How do I do that with my patients?
Love it. If anybody has any questions as a clinician, I'm happy to respond at any point in time. You can either reach out to Arthur or the team or myself, and I'll happily answer and give you any insight on things I do myself. Got a question for Elizabeth about the free version.
There is no cap on how long you can use it. It's completely free. The restriction is more so the use of the customization and how much you want to use. Like I mentioned, there's a cap of 10 pro actions per month, where a pro action is just the use of any customized template. And then on the free version, there'll be a little purple lightning icon that indicates what is a pro action versus what is a free. And I see Zakia is raising their hand. Hey, feel free to unmute.
Can you hear me, sir?
We can hear you now. Yep.
Oh, I'm sorry, I was not unmuted.
No
Yes,
problem.
thank you for the nice presentation. It is very exciting. I heard about your Heidi.ai from another doctors. He's using the free version. He really likes it. He told me about it. And today is the first time I'm checking it. And my question is, ECW is my e-clinical work is my EMR. Is it we can integrate it to ECW or we can't?
Yeah, more integration asks. So for ECW, for any cloud-based EMR, we also have a Chrome extension that helps with writing back the note. But so you can either use a Chrome extension one of two ways. One is you can have an overlay onto ECW. Maybe it'll be helpful if I just show this as well on my end.
Sure.
Yeah, I put my email address over there. If you have any opportunity, please give me a call.
Yeah, we can follow up afterwards.
Thank
But
you,
I'll
sir.
share my screen here. And essentially, right, I have an example Chrome extension test site. Imagine this is your EMR. You have, different boxes for the different sections. What I can do is I can open up the Chrome extension. You'll notice little Heidi icons pop up. And then I also have this overlay here of the note itself. So what I can do is I can go through the sessions that I have. And if I click through the Heidi icon, it'll load up sections of the note that are associated with it, right? So for example, if I click meeting date, then it'll output the meeting date. If I click attendees, it'll output the attendees associated with the note. That's one way to use this. The other way is if the button itself isn't loading up the sections of the note, you can just have Heidi as the extension as an overlay on your EMR. And then you can click directly, copy paste from, purpose of meeting, drop it in here, go into agenda items discussed, copy this, paste into here. The value here is really just being able to have everything on one screen rather than needing to go back and forth, just because it might be a nuance if you have multiple tabs open. That's the minor workaround for any cloud-based EMR that we're not directly integrated with yet.
Yeah, the extension's super easy to use, and it's nice to have it just pop up like that and pull it right in.
Lovely. Well, if there aren't any other questions for the group, and also kind of with Joe, with how this would actually be used in practice, what I'll do is I'll send a follow-up email over to everyone registered and everyone who attended, just to give them a notice that, hey, feel free to sign up on the website, try it out. And we're also going to be doing group onboarding sessions to help actually work through, individually, how would it work in your practice and help support you guys during the trial process. And then just for reference, my email is Arthur, ARTHUR @HeidiHealth.com. And if you want to reach out to Joe, I'll let Joe share his.
Yep, you can reach out to me anytime. It's JZUCCHI@transitionsalem.com.
Amazing. Well, thanks again, everyone, for the time. I know it's a late evening, and I appreciate you, Joe, as well, for your time as well. Yep. Thank you so much, guys. Take care. Bye-bye.